Good evening, friends. I am Dr. P.C. Jha from Kolkata. I am a physician and I encounter a peculiar problem mostly in adulthood. It can be over a wide range of age group, but the commonest problem which people do come to the doctor is the fatigue. The fatigue itself is a subjective term. It might be graded according to some comorbidities. It can be there without any comorbidity. But what we are going to have a little chat with you regarding today's topic is chronic fatigue syndrome. And this chronic fatigue syndrome is a peculiar morbid situation where a little bit of physical or mental exertions makes the person feel exhausted to the extreme. Here we need to stress on the fact that maybe this duration of I must mention that the duration of this fatigue must be about 6 months or over 6 months. Less than that, we don't call it chronic fatigue syndrome. It comes under other purview. Now, friends, this chronic fatigue syndrome can be due to number of comorbid situations. But the problem with chronic fatigue syndrome is that most of the reports and most of the investigational findings come within normal limits. So we have to evaluate the person's ability to carry out day-to-day physical and mental exertions without being fatigued is 0. Now we grade it to 1 to 11. So friends, if you are feeling and if you are facing this problem for more than 6 months, you must visit your doctor because there might be some remedies, though there is no definitive treatment for chronic fatigue syndrome, but there are remedies to keep you healthy. Now, this chronic fatigue syndrome can affect the person from head to foot. Like I said, uh, it could be fogging of your views. You have difficulty in concentration. You might have peculiar ideas, depression, agitation. You may have altered sleep pattern. You may have difficulty in focusing on a particular subject. You may have dizzy feelings, blurred visions. You may have altered sensorium. Your limbs might be feeling very weak. But one common factor is that is the joint and muscle pains. That is not associated with swelling or redness. So, muscle pain with fatigue, with altered sleep pattern, altered variations of mood. There are a number of factors along with joint pain and muscle pains, which may lead to the diagnosis of chronic fatigue syndrome. So go to the doctor, check for anemia, hypothyroid, diabetes, hypertension, dyslipidemia, and lots of other obstructive sleep apnea. But most often than not, these reports will be normal. So get in touch with a doctor and get yourself some help to get rid of this chronic debilitating disorder. Thank you, friends.